everyone, welcome back to my channel. This is Dr. Nakubiana Mufaya Siameka, or you can just call me Dr. Mufaya. To those that I know, you are most welcome. Please do subscribe to my channel and like my videos and share with your friends. So we continue with our diabetes series, and in my last video we defined what diabetes is, the types of diabetes, and how it's diagnosed, some of the symptoms and some of the causes. If you I will talk mostly on the types of diabetes, type 1 and type 2, and explain in detail, go into further detail about them. And at the end of the video, we'll talk about maturity onset diabetes again. I promised to talk about it in my previous video, so I'll talk about it in this video at the end. So please watch the video to the end so that you can get all the information. So type 1 diabetes usually affects young people below the age of 30 years. That's when it usually starts. About 5 to 10% of people that have diabetes have type 1 diabetes. It mostly affects Caucasians and less common in blacks and Asians and Hispanics. So mostly it affects Caucasians. So it's an autoimmune disease, meaning the body is attacking itself. So the body will tend to produce lymphocytes that attack beta cells in the pancreas. The beta cells in the pancreas are the ones that produce insulin. So when these cells are destroyed, the body tends to reduce the amount of insulin that is produced. That's why it's known as an autoimmune disease. Now, what happens is when the lymphocytes start attacking the cells, the amount of insulin starts going down, and the glucose will start increasing in the blood. So you would have a high glucose reading, but at some point, the body will go into what is known as a honeymoon phase, and this is a phase where the pancreas will compensate for that low insulin, so it produces more and more insulin using the cells that have remained. The few cells that are still left will produce more insulin to counteract the amount of glucose that is accumulating. At some point, the body will become tired and it will just become overwhelmed, so the amount of glucose will go very, very high and the insulin will go down, so meaning there will be no more beta cells producing insulin, and that's how you end up with type 1 diabetes. It's mostly genetic. About 95% of people who have type 1 diabetes have a genetic component. They have a gene that manifests itself and causes this condition. So what are the risk factors for type 1 diabetes? The major risk factor is a person who has history of autoimmune diseases, other autoimmune diseases like Graves' disease or myasthenia gravis, or a person who has a strong family history of autoimmune diseases. So let's talk about type 2 diabetes. Type 2 diabetes usually affects people who are about 40 years and above. Type 2 diabetes usually affects black people, Asian people, Hispanics, Aborigines. It's less common in Caucasians. So type 1 is more common in Caucasians, while type 2 is less common in Caucasians. So type 2 diabetes accounts for over 90% of patients who are diabetic. So it's the most common type of diabetes. 90% of patients that have diabetes will have type 2 diabetes, and only about 5 to 10% will have type 1 diabetes. I mentioned that it's more in people who are 40 years and above, but it's also been found that pediatric patients, younger patients like children, are having type 2 diabetes due to obesity. So we need to watch out for children and make sure that they are fed nutritious food and not overeating and not becoming obese. So type 2 diabetes also is genetic. It's been found that there are several genes that someone can inherit that can manifest themselves and cause someone to have type 2 diabetes. So if you have family history of diabetes, degree relative who has diabetes, then you are most likely to also have it later on in the future. So it's good to know your family history, to know who has and who doesn't have diabetes in your family, so you know if you are at risk, at a higher risk of having diabetes. Now, what really happens with type 2 diabetes for you to actually have it? I will talk about the risk factors in a minute, but let me just mention that it's a combination of several factors that eventually lead to having high blood sugar in your blood. So you have less production of insulin from the pancreas, and also insulin resistance in your muscles, and you will also have increased production of glucose in your liver. So all these factors are what affect your glucose in the blood, eventually resulting in high blood sugar levels. So I mentioned you have reduced insulin secretion, you have insulin resistance in your muscles, and you have increased hepatic production. So we now talk about the risk factors of type 2 diabetes. Obviously, age would be one. If you're above 40 years, meaning you are most likely to have diabetes type 2. So age more than 40 years. Ethnicity, like we said, Africans are more prone to diabetes type 2. Africans and Asians, Hispanics and Aborigines. Obesity also is a risk factor for type 2 diabetes. Family history of diabetes, a strong family history. So first degree relative of diabetes is also a risk factor. History of hypertension or dyslipidemia, history of having gestational diabetes. Now, gestational diabetes is diabetes when you are pregnant and you've never had diabetes in your life, and then you're told you will have diabetes or your sugar is really high. That's known as gestational diabetes. We didn't talk about it last time, but let me just mention it now. That's also a risk factor for type 2 diabetes. So other risk factors would be certain medications like antipsychotics. The last risk factor that I'll mention is polycystic ovarian syndrome. It affects women, and if you have this condition, you are prone to become diabetic. You can or may not become diabetic. It's a very high risk factor for having diabetes. So that's it about type 1 and type 2 diabetes. We talk about how they come about and also the risk factor. So in my next video, I'll talk about the treatment for both type 1 and type 2 diabetes. So look out for these videos. Now, I promised to talk about MODY. MODY is a group of conditions that is characterized by high blood sugar. So there are several types of MODY, or several types of MODY, but the most common ones are MODY type 1, type 2, type 3, and type 5. Type 1 and type 3 are very similar to your type 2 diabetes, and they have similar symptoms and similar presentation, similar history, and similar risk factors. MODY affects mostly young people who are less than 30 years. We'll talk about the treatment for both type 1, type 2, and also MODY in the next video. So that's the end of the video for today. I really hope you have learned something. If you really want to know more, please look out for my next video. I'll talk about the treatment and some of the complications that patients with diabetes present with, and what you can do about them. Yeah, so please share, like my video, and subscribe to my channel. Also follow my page on Facebook. It's Dr. Nakubiana Mufaya Siameka. And if you have any questions, leave them in the comment section, because I will do a video answering your questions. So leave your questions in the comment section. I will see you in my next video. For now, it's bye.